at an essential score of 74.8%, and they reported that they did not have, the important score was non-applicable. Now, when we compare the scores that they were given by the hospital with the attached information, which was their ideal hospital realization and maintenance framework assessment reports for the past financial years, we then observe the following as the Commission for Gender Equality. We observed that for the financial year 2021, the report that was submitted, the scoring criteria that they have submitted for the 2021 year was, it differed from the subsequent years, which is your 2022 and 2023 financial year. And therefore, as a Commission, we were unable to see, or were unable to analyze it and determine whether they meet the criteria in terms of the ideal hospital realization and maintenance framework. And then we also found that for 2022 and 2023 financial year, the Commission noted that despite the achievements, which were the scores that I've mentioned above, their scores were restricted to areas that did not include women's health services and services that clearly indicated a delivery of reproductive health services. And therefore, the Commission was unable to determine a measurable standard of care or services delivery in this regard, since no scoring was justified in BISHO in respect of women's health services. Now, just to explain this, we had to look into the subcomponent patient information and see what scores did the hospital achieve in respect of maternity. And under maternity, under patient information for the past 3 financial years, there were no scores under that. And that is why we're saying that even though they had achieved the scores, we were unable to determine under women's health what scores did they achieve. And thus, as a Commission, will therefore require clarity from the hospital why the criteria used in 2021 differed from the subsequent years, and secondly, to clarify if they have achieved the above scores, why were there no scores for women's health services. Also, the hospital was asked, before we get to access to care, the hospital was asked, as they indicated that their scores were 76%, they were asked to indicate whether, because they had low scores, to indicate whether there were any interventions that were made to improve the low scores. They did provide us with a table that indicated that they have procured equipment for cleanliness. They also procured equipment in order to ensure that the hospital is clean. There were also other projects that they have done, and some of the projects were still in progress. However, in respect to patient care, under that, the table that they have provided us, there was no information regarding patient information. And therefore, we were unable, also in this regard, to say that there were any interventions that were done by the hospital in order to improve this subcomponent, which is indicated as patient information. And therefore, we would require the hospital also in this regard to provide us with their quality improvement plan, and also to indicate, if they can indicate why there were no scores, or if there are any scores, to indicate those scores to us so that we can see, is there a gap when it comes to maternity? Is there an improvement that should be done when it comes to maternity, to women's health services? So in this regard, the information that they submitted was incomplete, and we need that information. They were also asked to report in access to care. And this one, the main reason for reporting in this one is because through education and training, but to Batupele principles, they empower healthcare workers and the public. This process involves sharing knowledge about the current health system, decision-making process, and funding allocations. Considering the above, the Commission requested the hospital to report on the performance of its hospital under the subcomponent access to care in relation to the ideal hospital realization and maintenance framework assessment scores for the past 3 financial years. And in response, the hospital reported that in 2021, they achieved a score of 76.74%, and in 2022, they achieved a score of 78.9%, and in 2023, the score was 76.2%. And again, our observation to the above information was that the Commission noted that the ideal hospital realization and maintenance framework submitted for 2021, again, the scoring criteria differed from the subsequent years. And in 2021, the criteria used pose a problem for analysis and determination. The Commission was thus not able to determine the measurable standard over the period of 3 financial years. For 2022 and 2023, again, the Commission determined that the hospital had achieved good scores. However, despite meeting most of the criteria, the facility failed to comply and given a status of not achieved. The Commission also noted that the scores received by the hospital during the financial years mentioned above were limited to areas that did not concern women's health. It was therefore not possible for the Commission to determine or measure a standard of care or service delivery in this regard, as there were no scoring was justified in the report for the Commission by the hospital. So to just explain that, also when we were looking at the scores that were reported, we also had to go back to the report and see if under maternity, what were the scores the hospital had achieved. Again, there were no scores when it comes to access to care in respect of women's health. That is why we are saying that even though they have achieved these scores, there were no scores when it comes to women's health. And therefore, we will then require the hospital to indicate why is that. They were asked to provide evidence of intervention, steps to improve the low scores. Apart from what is reported above, was requested to provide the Commission with evidence of steps and intervention taken to improve the low scores and the not achieved status. In response, the hospital provided the Commission with a list of areas within the hospital which have improved. However, on analysis of the information found that they do not relate to the sub-component access to care. The Commission will therefore require the hospital to provide it with the above information. They were also requested under the sub-component to provide us with their complaints handling procedures, which is, we requested the hospital to provide us with their complaints policy. How do they handle issues of complaints? And secondly, they were asked to provide us with their complaints registers. They were also asked to provide us with the minutes of the complaints committee. However, that information was not provided by the hospital. So we will therefore require that information in order to see what challenges the hospital is dealing with when it comes to complaints, how they handle complaints from the patients. And just to highlight that during our inspection, we did see some of the challenges from the hospital. One of the challenges which was of concern to the Commission was that when we arrived, most of the patients were using their own linen. And if there are no, I'm quite sure that there will be complaints in that regard. And without this information, we are unable to say that there were any complaints the hospital has received, and we are unable to see what challenges the hospital is facing. We therefore require that information from the hospital. They were also asked to report under clinical governance and clinical care. And under this component, they were asked to report on patient record management. The hospital was requested to provide their scores, grading, hospital status in respect of patient health record and management for the past 3 financial years, and they reported the following. The hospital reported that the same scores as sub-component patient information and access to care. The hospital further reported that they had achieved an average of 76.74% 0.74% in 2021 and during the financial year assessment, and it was reported that the score of 50% for maternity and 0% for outpatient and 66.64% for surgical services. On observation, again, we had to look into the reports that they have submitted. As mentioned above, the Commission noted that the hospital used the same criteria for the 3 subcomponents. The hospital must therefore explain the same scores for the 3 subcomponents. For 2021 fiscal year, when we look at the report, we also saw that it also posed the same problem as mentioned for patient information and access to care. And on analysis of 2022 and 2023, the Commission noted that the scores under this subcomponent, patient record management, revealed that women's health-related services have been prioritized, in that the scores under this subcomponent were 100%. Just to explain how we got into that conclusion, it's the same procedure that we have been using with patient information and access to care, which is we went to the report, look into the report, and under maternity, we can then say that the hospital had scored 100%, which means that they do, if I can just indicate how we got into that one, just a moment. Okay, thank you. For 2022 patient records, we looked into the standardized, whether there is a standardized record keeping is practice when admitting a woman in labor. And when we checked the scores, we saw that the hospital had achieved a score of 100%. We also look into the 4th stage, whether it's monitored. The 4th stage of labor is comprehensively documented, and the hospital scored a score of 100%, which means that they have done so well. We also looked into the acute or comprehensive surgical records are documented for women requiring cesarean section, and also in that regard, the hospital had scored 100%. We also looked into assessment of newborns is comprehensively documented. We also saw that the hospital had scored a score of 100%. We also looked into legislated requirements for admission of patient for 72 hours, observations are met. We also saw that the hospital had scored 100%. And the main reason why we looked into this, into the report, it was because these are the main elements that we look into when it comes to women's health. And we can then say that both for 2023 and 2024, the hospital had done so well in that regard. And for clinical organization, for clinical organization, the purpose of this question was to assess whether the services offered in respect of women's health are aligned with the hospital package services, and to what extent, and if there are any gaps. In response to the question, Bishop Hospital provided the Commission with the following information. Under the category Women's Health, it provided surgical and medical services, including gynecological, orthopedic care. In addition, it offers a 24-hour maternity services. In addition, it listed pediatric services under this category, and they noted that in terms of reproductive health, their services include termination of pregnancy, contraception, pap smear, 24-hour cesarean sections, and HIV and AIDS services, social workers, counseling services, allied workers such as physical therapy, physiotherapy, audiology, dietitian, dentist, and oral hygiene. As a follow-up to the above, the Commission requested the hospital to indicate the challenges that they have encountered in providing these services. And then in this regard, the hospital reported that they do not have an on-site Tutuzela Care Center. Bishop reported that currently the service is only offered at Grey Hospital, and in order for them to have a one-stop for the victims or survivors of gender-based violence, they would like to have their own Tutuzela Center. And considering that Bisho High Court is in Bisho, is closer to Bisho Hospital, it would be a good initiative for them to have their own Tutuzela Care Center. Secondly, Bisho reported that they offer a choice of termination of pregnancy service up to 13 weeks. This in results having 13 to 20 weeks being referred to other facilities, which have been reported to Bisho as an indication of the fact that there is a need of upskilling of their medical officers. However, I would have loved for the hospital to indicate as to when it comes to the choice of termination of pregnancy, which hospitals are they working with in order to provide a service to patients for 13 to 20 weeks, and also if their referral pathway is working effectively, and secondly, thirdly, to provide us with information regarding if there are any follow-ups that are done to ensure that patients do get the service. And lastly, according to Bisho's report, the commission, they were further requested to provide information regarding their catchment population, and they indicated that it is 65%. However, there was no numerical figure that was given to the statement. As a result, the commission was unable to quantify the extent of its reach in numeracy. Then, according to Bisho, they were also asked to report on the referral pathway. They provided a copy of the standard operating procedure for referrals to support this assertion. In accordance with the SOP, the referral may be from health clinic to a community health care center, then level 1 hospitals, then level 2 hospital, and finally level 3 hospital. In addition, the SOP that was provided provides for internal and departmental referrals. The SOP provides a list of feeder clinics and hospitals to which Bisho refer patients. However, in this regard, we were not provided with the challenges. What are the challenges the hospital is facing when they refer patients to other hospitals, when they refer patients to clinics, or when they receive patients from other clinics? What are the sort of challenges that they have been getting? So would like the hospital to indicate in that regard. They were asked to report on the maternal mortality ratios. The main reason for that is to see what is the contribution the hospital has been making in regards to the national statistics of maternal and neonatal deaths. And in this regard, the hospital only provided the commission with the following disaggregated data. For 2021, they reported that the ratio was 0. For 2021 to 2022, they reported that the ratio was 47.7. And for 2022 to 2023, they reported that the ratio was 98.8. On observation with this disaggregated data that we provided, we are unable to interpret as to how the hospital had arrived with or achieved this ratio. It was unclear whether the ratio is it a percentage or what is it exactly. So we want the hospital to clarify how did they arrive or how did they achieve the above mentioned ratios, and also to provide us with numbers. What are the numbers of maternal deaths they have received? Also, when it comes to the 2021, they reported that the ratio that they have achieved was 0, and upon analysis, the data was interpreted by the Commission, meaning that there were no deaths for both numerically and statistically in the financial year 2020-2021. And in light of the fact that these were the years where COVID-19 was at its peak, it seems arbitrary. The Commission will therefore require the statistical data report for the last 3 financial years to confirm the response by the hospitals. And secondly, regarding the data provided, since there is no numerical indicator to determine what 47.9 means or 89.8 translates to in numeracy, the Commission cannot determine what percentage mean in terms of growth or decline in variables. As a result, the Commission is unable to determine how Bisho contributed to the national statistic data on maternal mortality. They were further asked to present or to provide information regarding the early neonatal and neonatal deaths. And in respect to the above heading, the hospital was asked to provide a disaggregated data by financial year for the past 3 financial years, and they reported for an early neonatal death rate was 0.7, and for 2021-2022, 6.7, and for 2022 to 2023, it was 8.6. Now it's the same, we encountered the same problems as the maternal mortality ratios that were provided, and therefore we will require a full report from the hospital in this regards to see what are the numbers, what are also the causes of death when it comes to early neonatal and neonatal deaths, and also when it comes to maternal deaths, what are the causes? Under this paragraph, they were also asked to report on in-facility delivery for 10 to 19 years. And again, the hospital did report the data. However, it's the same issue as maternal deaths and neonatal deaths. The hospital reported that they only gave us the ratios without the numbers. And considering that Eastern Cape, when it comes to teenage pregnancy, it has the highest number of teenage pregnancy. We would have loved to get numbers. What are the numbers the hospital has been getting when it comes to in-facility delivery for 10 to 19 years? So we'll therefore require a comprehensive report of which will provide us with the numerical data of the in-facility delivery for 10 to 19 years. And lastly, the hospital was asked to report on the workforce. They did provide us with the disaggregated data, and these were the numbers. Under level 2, the hospital reported that they have a total of 51 employees, which includes, there is no representation for people with disabilities. And in respect, when it comes to a representation by sex, black females, there are 36 black females. And when it comes to representation of the colored females, there are no colored females. And when it comes to representation of Indians, there are no Indians in facility. And also there is no representation under level 2 when it comes to white females. And when it comes to representation of males, there are only 15 black females and no representation for colored and Indians and also white. And also when it comes to foreign nationals, there is no representation of foreign nationals across all the levels until level 12. There's only one foreign national under level 12. And what we've seen as a commission, if you look at the table that the metrics that was provided by the hospital, you will then see that there is a lot of representation of black females across all the levels of salary levels of representation. And also we will then see that there is a lack of representation of people with disabilities. There's also a lack of representation of sorry, just a minute. Okay, I think just to say that there is a lack of representation. Overall, the metrics provide a valuable insight into the gender, racial, foreign composition of Bisho staff members. The information can help in analyzing and understanding that although they are diverse workplace within the institution, the health sector is still predominantly female, and it is understandable that this ties in with whom the sector attracts more in relation to bedside healthcare services. So what, as the Commission, will require from the hospital to find clarity if there were any measures that were put in place by the hospital in order to attract the other races, and also if there are any measures that have been put in place in order to attract people with disabilities. And in conclusion, I can then say that the hospital had provided us with incomplete data, which made us unable to make a proper determination whether the hospital had achieved their assessment for their ideal hospital realization and maintenance framework for the past 3 financial years. And we were unable to also look to find that if there are any challenges that the hospital is facing when it comes to providing services to patients, especially when it comes to women's health services. We will therefore require the hospital to provide us with more data in order for us to make a proper determination. Thank you.
Thank you for the presentation. The items to follow will be the administration of the oath as well as a presentation by the CEO of Bisho Hospital. But before I hand over to Mr. Bradley Swanepoel to continue with the administration of the oath, may I please ask the CEO of Bisho Hospital to join me at the podium and to also come along with her laptop so that we can connect it. I will then hand over to Mr. Bradley Swanepoel to administrate the oath.
Good morning, ma'am. Could you state your name for the record, please?
My name is Phumla Mnyanda.
Do you wish to take an oath or an affirmation?
What's the difference?
An oath is religious, an affirmation is not.
I think religious.
Oath. Okay, all right. Please repeat after me.
Okay.
I, Phumla Mnyanda,
I, Phumla Mnyanda,
do hereby make oath and state
do here make by oath and state.
I know and understand
I know and understand
the contents of the declaration
the contents of the declaration
I am about to make.
I'm about to make.
I have no objections
I have no objections
to taking the prescribed oath.
to taking the prescribed oath.
I consider the prescribed oath
I consider the prescribed oath
to be binding on my conscience.
to be binding on my conscience.
Please raise your right hand
This way.
and repeat after me. I swear
I swear
that the contents of the declaration
that the contents of the declaration
are true,
are true,
so help me God.
so help me God.
Chairperson, I confirm that the deponent has been duly sworn in.
Thank you. CEO, you may proceed with your presentation.
Okay, I think good morning, ladies and gentlemen. I think for a disclaimer, I'm very scared. I've never been to court. I always thought it's a good thing for my age not to be in court because it means I don't break the law. And secondly, I've never made that kind of oath the first time, so a little bit shaken. But I think first thing I need to talk about Bishop Hospital, just to give you a little bit profile about Bishop Hospital. There's a message there say you are a provincial hospital. We're not a provincial hospital, we are a district hospital. So we are the babies of those two hospitals sitting there. It's a good thing we have to go first. Bishop Hospital is a district hospital, 5 kilometers from Bishop Legislature in King Williamstown. We are not in Bishop Legislature, we are in the rural area, just outside Bishop Legislature. But people always mistake us thinking we are in head office. We are not in head office. And we were established in 1991. We are a 260-bedded hospital. But what we are using now, we are using about 164 because of infrastructural challenges. We've got about 27 feeder clinics, which are PCM, we are at PCM. But we are in the borders of other districts like Yokrisani and Amatole, ending up to having about 38 clinics. Okay, there. I'm trying to, because I know that question is going to come. That's the service board. We are providing the whole package of district health. There's them. The strengths, we are Bishop, very spacious. We've got a very spacious hospital, a dedicated, devoted team, staff eager to do outreach, supporting surrounding community, eager to work with the community surroundings. But I want to go to the staff challenges just briefly. We've got critical staff challenges. Must I not do this? We've got critical staff challenges. I need to get to that so that probably when we are judged, these things are actually known. There's a CO, which is me. I don't have the middle manager. I've got an acting clinical manager because my clinical manager has been sick for a while. I've got a nursing service manager, which is a matron of the hospital, and there's supposed to be about 3 or 4 matrons under that nursing service manager. I don't have not even one area manager, so there are no matrons. So the whole nursing department is failing short in being supervised. I don't have the senior person in administration. I've got just a level 7 in HR who's doing with HR issues. And then in finance, I don't have people who are senior in finance. They were suspended. I started at Bishop 2020, July, during COVID. They were suspended because of some fraud before that time, and they haven't been replaced. So we are just managing our finance with a level 7. So those are the challenges in terms of managing and administration of the hospital. I don't have the information person. The people who are helping me with information is data capturers. And then with the clinical, I don't have critical people, non-clinical, which are critical, like your porters. I've got 1 porter. I don't have artisan and groundsmen, and we find that our infrastructure is terrible because we don't even have 1 groundsman and 1 artisan. We've got about 4 people we have maintained at maintenance, no artisan in that, no mortuary attendant. We've got 2 porters and 1 porter is doing mortuary attendant. Radiographer, we've got 1 radiographer, which actually makes us not to be able to open after 24 hours. I want to touch in our BUR, which is, I'm sure if you go to our performance and thing, you'll see that our BUR is ever low. The reason our BUR is ever low, we are 260 bedded hospital, but we're using 160. And when they calculate out of 160. So because we're not using half of part of the hospital because of infrastructural challenges, we are low there. BUR2 is always low, is less than 50%. But if you have to calculate under 160, then you'll find that we are 80 or 85 every time. I need to talk about water. We've got an unreliable water supply due to water shedding, due to load shedding. Unfortunately, Bishop Hospital, we don't have a standalone water reservoir. So our water is connected to the rural areas around us. We are in the center of a rural area, both angles, at the left and the right, it's just rural areas. The reason with laundry, I think it was mentioned here, but I don't understand patients were using their linen. I don't understand. It's a pity I was not there that day. We do have linen, but we normally have problems with laundry because we're still using the boiler system, and our laundry is supported by boiler system. And the boiler system, we've been talking about it, that it needs to be stopped so that we use electricity, and all the time there's intermittent services at the boiler system. It's either it's not working, and then our machines at laundry, they're using that, so we can't use that. I think I know psychiatric ward, but that one we are busy doing it.